A nursing home and long-term care centers across the tri-state and nation are reviewing a new vaccination requirement for their workers.
The Biden administration announced employees must be vaccinated for their facilities to get Medicare and Medicaid funding. Eyewitness News' Mike Pickett with the story.
President Biden said the vaccination requirement for nursing home and long-term care workers to be vaccinated to get Medicare and Medicaid funding is about keeping people safe and out of harm's way.
We understand we do take care of a very vulnerable population, but so do other healthcare settings.
Betsy Johnson of the Kentucky Association of Healthcare Facilities says those centers are being singled out in the new requirement and could also lead to a workforce shortage by workers hesitant to be vaccinated.
When you leave it open where a healthcare worker might be hesitant to get the vaccine and is now facing a mandate, that healthcare worker in the long-term care setting may choose to go work for a hospital or a home health company that is not mandating the vaccines.
In Indiana and Kentucky, CDC figures show vaccination rates for nursing home staff range between 50 to 60%. In Illinois, it's between 60 and 70%. Red Bank's executive director Sherry Newton says facilities like hers wouldn't survive without federal funding, with 90% of residents under either Medicare or Medicaid.
I believe that everyone in these facilities needs to be vaccinated.
Governor Andy Beshear says he knows staffing is hard to find for these facilities, but they have a responsibility to be protected to protect those they care for.
We're going to have to look at both those issues as they come, but listen, if this is what the federal government says is required to get the funding, then every single facility that receives that funding is going to have to do it.
In Owensboro, Mike Pickett, Eyewitness News.